Hey guys, so I wanted to put this video together because it is going to be somewhat of a teaching moment. There's something that I experienced or have been experiencing since the end of last year. So we're talking about like November, December 2022 until literally now. And today it is June 2023. So I have a little dog, which many of you might know about, and I adopted her almost 2 years ago. July 2023 will be 2 years since I've had her. I adopted her with health issues. She has a lot of skin and allergy issues. Total coincidence. I did not do that on purpose. Been managing her symptoms with conventional medications because they have been needed, as well as I've been doing some supplements and such for her as well. So the end of last year, 2022, she started developing a cough, and it was pretty severe, coughing all night long, keeping myself up. She wasn't sleeping. Very aggressive cough. So multiple vet visits, rounds of antibiotics. I even had a vet give me a PPI because he thought it was her gut. I tell you the truth, I did try it because I was that desperate. Didn't solve the problem. Multiple rounds of antibiotics over the months seemed to help slightly, but not a lot. Then around, end of May 2023, so around the Memorial weekend, the cough got severe again. So I took her in to the vet, and I took her to a vet that I've been seeing that is conventional and holistic because, I like that he does the supplements and probiotics and working on her gut and such. So we got her on another round of antibiotics, also started treating her for respiratory issues, which obviously because of the cough. So part of that diagnosis actually had been like allergic rhinitis and allergy related symptoms. So she's even had some steroid shots, which again seemed to help minimally, but nothing long term. So end of May, she ends up on another antibiotic. And so this was like on a Saturday. So by Tuesday, she's not really eating very much. And I'm starting to get really concerned. She's also starting to walk like super hunched over. And by the way, she's about 7, 8 years old. So she's a little bit older as well. So she's not doing very well. This was actually last week. So I started calling around, and I went back to my conventional vet, and I was very specific with the doctor that I actually wanted to see. Got in to see her, and this was Saturday, was a week. So it's been about a week and a half. So got in to see her, gave her an exam, and looked in her mouth, and she had 2 abscessed teeth. Okay. So 2 abscessed teeth. And mind you, over these months that I've been taking her in, I've looked at her teeth. I didn't know what I was looking for. Apparently the vets hadn't picked up on this, that I had seen picked up on this either. So, and I guess I'll back up a little bit too. So when I got her 2 years ago, she, again, not in good shape at all. I got her from a rescue. Most of her mouth was pretty rotten. So I actually had dental done for her 2 years ago, and they pulled 9 teeth at the time. So she's only had 4 teeth, the 2 top canine and the 2 bottoms. So yes, I had been getting reminders from the vet that it was time for her dental a year ago, but she only had 4 teeth. So I didn't think it was such a big deal. And I was brushing them myself. So again, fast forward back to about a week and a half ago, 2 abscessed teeth. So ended up getting her in for dental again to get those teeth removed. I was told by the vet they were absolutely just super infected. They were pussy. So she has been on antibiotics now. Tomorrow will be a week that she had the procedure, and she's almost done with the antibiotics, and she is doing amazing. She is eating. She is walking pretty well. She's not super hunched over. That is another story. She does have degenerative back issues, but she's in a lot less pain, and she is not coughing. So this is my long way to get at sharing with you how important it is to understand what's happening in the mouth with your child. And this is, why I'm thinking about this. So here I am with my little dog who really doesn't have any teeth. So I wasn't paying as much attention as I should have to her oral microbiome and her oral health. Well, all of that bacteria and all of that stuff in the mouth, she was swallowing it. And that, in my mind, is most likely what has been causing her respiratory issues all of these months. The level of infection that she had in her mouth, that does not happen overnight. So again, I'm just floored at how well she's been doing now that we resolved what's going on in her mouth. And the reason why I want you to know this is because so many of you, on my intake questionnaire, for example, I ask about dental health for your child. And do you brush? Do you floss? And so even though your child might not have teeth yet, or maybe they have a few teeth, I just want to point out how crucial, absolutely crucial it is to take care of oral health for overall health. Certainly all of that bacteria that's in the mouth gets swallowed, it ends up in the gut. And a lot of that bacteria can become inflammatory, and inflammation is an underlying driver for chronic skin rashes like eczema. So also when you think about it, especially if your child is super little, even though they might not have teeth or might not have a lot of teeth, when there is food in the mouth, and certainly like you're introducing solids, right? There's like the food kind of pools and sits there. That is ripe for bacteria to feed on. So please, please, please make sure to pay attention to your child's oral health and keep the mouth clean, not just around the mouth, but inside the mouth. Make sure to get the food particles and such out. And definitely, as soon as your child starts getting their teeth, make sure to brush them. As soon as there is something to floss, make sure to do that as well. So I hope this is helpful. And I hope this demonstrates really how important it is to take care of your child's oral health for their overall health and wellness.